Namaste, welcome back to our channel. My dear student, today's session about oligohydramnios. Let me tell what is the meaning of oligohydramnios. So here there is a third trimester here it is telling. What is the meaning of third trimester? As we know that for the antenatal time there is a three kinds of the trimesters are there. First trimester, second trimester and third trimester. So last 3 months of the pregnancy time is called as third trimester. Actually, during the third trimester, the amniotic fluid. So, what is the meaning of here amniotic fluid? The fluid which is secreting from the amniotic and chorionic membrane within the mother womb, within the sac, that fluid is called as amniotic fluid. If it is 1000 ml, if it is 600 to 1000 ml, that will be the normal. If it is less than 1000, if it is less than 600, might be the 300 at the term level, that will be called as oligohydramnios. If it is more than 1000 ml, like 1500 or 2000 ml, that will be called as polyhydramnios. Where we can see our condition is called as oligohydramnios. We can see at the third trimester, if the amniotic fluid is less than normal, so how much? If it is 300 ml, that will be called as oligohydramnios. So what will happen in the case of oligohydramnios? So fetal structure will be getting deformity. The structural abnormality may chance to get. So what is the normal kinds of the amniotic fluids? So at the 4 to 8 weeks, 20 ml may secrete, 20 weeks 350 ml, 37 weeks 700 to 1000 ml at the term. In the sense 40 weeks 600 ml of the amniotic fluid may chance to present. But in the case of oligohydramnios, there is only 300 ml of the amniotic fluid we can able to find. So you can see that diagrammatically. So every fluid, I mean, it is not filled with the fluid, it is empty. So there is a less fluid is present at the term. So at the third trimester. So that is called as oligohydramnios, where we can see. So what are the signs and symptoms in the case of oligohydramnios? So if the mother is having less containing of the amniotic fluid within the mother womb, so smaller uterine size, the uterine size will be the small, less female fetal movements. So if there is no the sufficient fluid, if there is no sufficient amniotic fluid within the mother womb, the fetal movement may get disturbed. That is, the fetal less movements may occur, and uterus feel completing of the fetus. There is no fluid, and malpresentation will occur. So presentation is not at all abnormal, I mean normal, it may get abnormal. That is called as malpresentation, and this is the evidence of intrauterine growth retardation. So within the uterus, the growth of the baby is retarded. So that will be some kind of the symptoms where we can see what kind of the causes, what is the etiological factors to get the oligohydramnios. The first one is maternal condition, due to any kind of the maternal conditions, and next one is blood pressure. If the mother is having feels more than normal blood pressure, like 150 or 160 by something, so in that case the mother feels less secreting of amniotic fluid, and also uteroplacental insufficiency and dehydration, idiopathic chances, post-term pregnancy, as well as pre-labor rupture of membranes. If it is pre-rupture of the membranes, amniotic fluid may chance to get leakage, losing of the fluid. So this is may chance to getting of oligohydramnios. How we can treat in the case of oligohydramnios? The first one is give adequate rest to the mother and give her hydration. How you can give the hydrate to the mother? In the two ways are, the first one is orally, the second one is that is IV method, intravenous method. By using of this kind of two methods, we can hydrate the mother for getting sufficient amniotic fluid. And next one is severe, matlab you just monitor with the mother with the help of USG and this kind of the other kind of the techniques. And next one is, if it is mother in the severe condition, then differently you need to go for induction of the labor as well as LSCS. So this is the sort of treatment where you can find, where you can treatable with kind of oligohydramnios. So that's about today's session, my dear students. So today I have discussed about what is the meaning of amniotic fluid and what is the abnormalities of the amniotic fluid, there is two kinds of the abnormalities are there. One is oligohydramnios if it is less than normal. If it is more than normal, that is called as polyhydramnios. So what are the causes and what kind of the treatment we need to do in the case of oligohydramnios mother? That's about today's session. I will come with next session with another topic. Until then, stay tuned. Please like and share. Don't forget to comment. Please subscribe. Thank you so much, my dear students.